We'll be going through. I don't know if everyone can see us. So we're looking forward to a lively discussion and getting us towards some solutions or ideas by the end of the hour, which we're excited about. Jonathan, do you have any other?
No. I think the guests can actually see.
Yeah. Wonderful. So let's jump in. We'll give everybody probably about 2 more minutes to join us. I know we have a good number of registrants who are attempting to log on, and so we'll give them to about 3 or 4 after, and then jump in to our introductions. Thank you for joining us. And just to remind guests is please send us any messages using the question and answer function, and we will do our best to make sure everyone's questions are addressed and answered throughout the next hour.
It looks like Doug is on as a participant. He just needs to be promoted to.
Okay, great. Fantastic. I'll give it another minute or so.
Dr. Hotez, this has been an interesting COVID week.
I'm tired of interesting COVID weeks.
Yeah,
I want boring COVID weeks. So.
Yeah, so am I.
I thought I was going to have a good summer, and
I'm at this stage. I'm becoming more and more speechless, which Doug and several others can tell you is not the typical Jonathan. I'm never very speechless, but what I've seen thus far and
well, it's the unforced errors that are just mind-boggling.
That's the frustrating part.
Can you hear me?
Yes.
Absolutely.
Okay, excellent.
Welcome, Douglas. Nice to see you. What's interesting, Dr. Hotezo, is in New York, as I'm sure we have a lot of people who are hoping for interesting COVID weeks, as it might detract from other non-COVID stories that are happening.
Yeah, no, New York is what they're doing in New York is interesting. We can talk about that. Happy to.
Yeah, absolutely. Well, let's jump in. Jonathan, Drake, you guys good to go?
Yes.
Fantastic. I think we're ready. Well, I want to give a huge welcome and hello to everybody. I'm here in Guyana, in the Caribbean, and we're really excited for you to join us for this Color of COVID conversation, which is hosted by the PathCheck Foundation, the Institute for Technology and Global Health, in partnership with Hood Medicine. Myself, I'm Sienna Leis, and I'm one of the founding members of the PathCheck Foundation last February already, and also part of the founding leadership team of the Institute. I'm a recent graduate of the Harvard Kennedy School, where personally I've been focused on crisis management in the face of disaster, which quickly evolved to COVID last spring. Together with Drake Johnson, we have spent the better part of last year really focused on the overall disproportionate impact of COVID on communities of color, and are really excited to continue the conversation today. Drake?
Yeah, it's exciting to finally be here to speak on such an important topic. So my name is Drake Johnson. I'm a rising senior at Harvard studying government and African American studies. I joined the PathCheck team last year when the pandemic first kicked off, and worked in some of the government outreach and correspondence efforts early summer, and then started working with Sienna on stuff related to equity and justice and COVID response. I want to give a huge welcome and thank you to our partners for this event. The Hood Medicine Initiative is a nonprofit public health collective made up of scientists, hackers, and other assorted geeks who are dedicated to improving the health of Black and Brown people in the communities we live in. The Global Co-Creation Lab is a high-tech concentrator answering many of our era's greatest challenges in health and medicine. They're another MIT-founded project that began with a collaboration with Miami-Dade County before COVID, and they continue to identify and implement the best ways to utilize digital technology in improving our resilience in this pandemic. The We Got Us Empowerment Project is a Boston-based collective of Black community members, health professional students, and allies dedicated to empowering our communities with education about medical racism, COVID-19, and the vaccine. The Ronu chapter of Alpha Phi Alpha Fraternity Incorporated is composed of students from the Massachusetts Institute of Technology, Harvard College, Tufts University, and Babson College. Representing the legacy of Black community organizing on college campuses, the Ronu chapter provides programming for intellectual enrichment, professional development, and service across the Cambridge community. And our webinar host, PathCheck Foundation and the Global Institute for Health and Technology are nonprofit spinoffs from MIT that are using leading technology to deliver pandemic solutions not provided by the private sector. PathCheck led the charge last year with the work of exposure notification and has continued to work over the past year as our knowledge is expanding about the virus. Today's webinar will consist of a conversation between myself, Sienna, and our moderators on vaccine hesitancy in communities of color. Please, we urge you to use the Q&A function or the chat function to submit any questions, and we'll try to incorporate them where we can.
Absolutely. Thank you, Drake. And we're really excited. Drake and I have been talking about this for literally about a year, and we've had various webinars and various conversations that some of you that are online have participated in that really started with hesitancy with communities of color as it related to digital contact tracing, which was the first real conversation that we had about a year ago as it related to COVID. And that conversation, as COVID has evolved, the conversation obviously has evolved, yet we still have this disparity between certain communities in the United States, of course, but really it's around the world, which is why we're really excited to dive in with more of a global perspective today. So in addition to Drake and I, you've already heard a little bit from Jonathan White. Jonathan is the co-founder and policy director of Hood Medicine Initiative. And Hood, as Drake described, is a nonprofit public health collective. There are many conversations happening around the country focused in the same way that Hood is focused, but Hood has really stood out to us in the way that they have brought together both community leaders, leaders in the industry, including Dr. Hotez, to really get a conversation going that transforms into policy and action, which is where we hope our conversation will go today. We are also joined by, as I mentioned, Dr. Peter Hotez, who I struggle to confine or consolidate your bio, but we've described you as American scientist, pediatrician, and advocate in the fields of global health, vaccinology, and neglected tropical disease control. He serves as the founding dean of the National School of Tropical Medicine, professor of pediatrics and molecular virology and microbiology at the Baylor College of Medicine, and is also the director of the Texas Children's Hospital Center of Vaccine Development. I imagine we'll touch a little bit upon some of the issues that are arising related to school being back in session this fall and children being vaccinated in general. I'm also very excited to be joined by the Honorable E.J. Saunders, who is the Deputy Premier of the Turks and Caicos Islands. He is currently responsible as the Minister of Health and Human Services, which includes managing the Turks and Caicos government response to the COVID-19 pandemic. Where the Deputy Premier for us is a voice that we're so looking forward to hearing from is the actual challenges facing the person or persons responsible for distributing and ensuring that the public is vaccinated. And I'm excited to hear a little bit more about the success that they've had there in terms of encouraging people to get the vaccine. And finally, we are joined by Doug Slaughter, who, in addition to being a part of the Hood Medicine team, is also an epidemiologist with the CDC Foundation, which is an independent nonprofit. It's a sole entity that was created actually by Congress to mobilize philanthropic and public sector resources to support both the core CDC and prevention's critical health protection work. And so I think between the four of you and hopefully Drake and myself, we'll be able to give a really well-rounded perspective in terms of where we are today with COVID, vaccine hesitancy versus resistance overall, and what we can be doing to encourage people to get vaccinated. Drake, can I have you?
Yeah, there's a lot, I think, to unpack in that conversation. And so I think a good place to start is, kind of what's going on. I mean, we have the Delta variant and a lot of conversation around that. Dr. Hotez, can you share a little bit about, what the landscape is and the challenges, I think, right now in terms of COVID spread?
Yeah, sure. I mean, I think the landscape is, I think we thought that we wouldn't be having this discussion, that we were on a good trajectory back in April, May of vaccinating the country. And we all had a lot of optimism that we were going to have a great summer, that we potentially could have vaccinated our way out of this epidemic. But unfortunately, our ability to vaccinate, because there were good vaccines, it wasn't a problem with the vaccines. They were high-performing vaccines, both the mRNA vaccines, the two from Pfizer, BioNTech, and Moderna, and the J&J vaccine. The problem was vaccination stalled, and they hit a real thud starting into May and June, and now we're in this situation where we have not just hotspot areas, but large regions of the country that are mostly unvaccinated in terms of young people. So one of the big problem areas is the entire South, extending from Texas across the Gulf Coast of Florida, then up into the Carolinas. What we're seeing is the older Americans are doing a little better, over, pretty much 80% and over. But then basically none of the adolescents are vaccinated, or under 20%, and none of the young adults. And that's problem number one. It's also true of some of the mountain states like Wyoming and parts of Utah and Colorado. Problem number two. And if we still might have been okay were it not for the fact that this gap, this inability to vaccinate, allowed a variant to enter into our country from the UK, the Delta variant. And this is far more transmissible than anything we've seen before, with a reproductive number of 6 to 8, meaning that if a single individual gets it, 6 to 8 others who are unvaccinated will also get it. And now this is taking off like a forest fire across the southern United States in a fourth wave, and also in some of the mountain states. But the South is terrible right now, and especially states like Louisiana and Florida, Mississippi, Alabama, Arkansas, Texas will get hit next, I would predict. And it's a lot of young people now are being hospitalized and even going into intensive care units, even pediatric intensive care units. So we're paying a steep price for our inability to vaccinate the South. And other parts of the country are doing much better. So Vermont, Massachusetts, New England states, Mid-Atlantic states, that the thing has not really caught on in a big way. There's some uptick, but it's still modest, and most parts of the West Coast. But right now, the South is raging, and we're seeing the pediatric intensive care units start to fill up, and school hasn't even started. And that's the other big concern. We're going to be open to in-person classes, and a lot of the governors of the states, with the exception of Louisiana, have sort of hand-tied us in terms of our ability to fight this. None of the states have vaccine mandates, and most of the southern states are refusing mask mandates, which are, the only two weapons that we have. So I worry this thing is going to accelerate more. I don't think this Delta variant is necessarily specifically targeting the kids. I just think anyone who's unvaccinated at this point is now getting infected, and kids are getting swept up in all of this. And so one of the big questions is, what do we do about the South? How do we fix that? What do we do about some of the other regions of the country where people aren't vaccinated? And because what we're seeing is wherever you have that 1-2 Delta punch, high Delta, low vaccinations, things really spread rapidly. And now the kids are starting to get it, and we'll get it more as schools open. So we're in a very difficult situation right now. And as bad as it is, as schools open, and they open early in the South. So in Houston, schools in Houston Independent School District, they'll open August 23rd. Many parish schools in Louisiana next week. Some in Mississippi have already opened and actually closed because they couldn't sustain the COVID control. So this is, and of course the great tragedy, and we'll do a deeper dive in this hour, is we didn't have to get here. This is all an unforced error. This is our self-inflicted wound, whatever metaphor you want to use. And that's our current situation. And don't even get me started about Africa, Latin America, and Southeast Asia, because that's yet another humanitarian catastrophe. And I'm glad we have representation from the Caribbean. I'd be curious to hear the minister's perspective. I know Cuba is terrible right now, but he could probably enlighten us what's going on there as well.
Absolutely. And Dr. Hotez, I think that's such an important point. Being physically in South America right now, is a lot of the comment is we don't even talk about the Lambda variant. You know, we have other variants that are occurring around the globe that aren't even on our kind of dialogue or radar. And so that to me is the most frightening thing. I will segue to Deputy Premier Saunders. Is I would love to have you address the question that Dr. Hotez just asked, is what is the landscape right now in Turks and Caicos? Does what's happening in the Caribbean match what's happening in the US? How does one inform the other?
First of all, thank you. Can you hear me?
Yes, yeah.
Okay, thank you. What's going on in the Caribbean? The Turks and Caicos. So far, we've been doing fairly well. I think we mirrored the United States, not as bad. The issue that we're having is that we're getting the Pfizer vaccine from the UK, and they've been sending it on an as-needed basis, and we've done fairly well. We're now at our batch, and we were testing 25,000 adults who've been vaccinated. So in terms of percentages, we're looking at about 35,000 adults. So out of that, today we're about 67% fully vaccinated out of the 35,000 adults, and we're at 71% but partially vaccinated. Our positivity rate right now in terms of the virus, we're at 28, and something happened over the weekend. We sent out 8 positive samples to be sequenced. It came back with 4 of them being found to have the Delta variant of the virus. 1 was a tourist, and 3 was community spread. 1 out of the 3 was fully vaccinated. 1 was partially vaccinated. And so at around early July, we went all the way down to 0 positive cases. And we were doing fairly well for about a week, and then it inched up 5. We had 5 positive cases. And tell you 2 things at the same time. We had 5 positive cases, but the 5 were tourists. Tourists mainly from the southern states of the United States. Then that 5 jumped to 11. 10 out of them were tourists. And then we started seeing community spread. So when we got up to 19, 16 were tourists, and we got as high as 33. And now what we're seeing is that we're adding about 2 or 3 every day. Most of them are tourists, and that's got us baffled. But as we bring on new cases come on, we have a few recoveries. So we've been staying pretty steady at low 30. So we think that we're doing actually a pretty good job. But what happened though is that our vaccination rate has slowed down completely. Like we moved pretty quickly all the way up to about 63, 64%. And then all of a sudden now we're just adding a little bit every week. So in terms of vaccination, we probably added 200 or 300 in the last week. So we've been now at about 67% now for almost 2 weeks, and we're just not growing anymore in terms of vaccination. But we've got the vaccines. We've got a lot of vaccines. And the UK is sending it to us on demand. So if we needed more, they will send it. But their last set of persons are just not getting vaccinated. And it's causing us a huge problem. Now, what we've done to pick that up a little bit is that we made all work permit holders, and if it was in the United States, it would be similar to green card holders and work permit holders. We've made it mandated that they have to be vaccinated or they wouldn't get a renewal. And that got us up from about 62 to 60% to where we are right now. But we're having a difficult time. And now and because it's summertime and everyone wants to get out, Turks and Caicos is a hot destination, so we have a lot of tourists coming to the country. They're having a lot of parties. So we've actually taken a very firm stand against parties, particularly the outdoor beach parties. Over the weekend, we had a lot of fines for persons going way over the mandated number. We have a cap on 100. We've seen a few parties at around 300, 400, 500. So we had the police out quite a bit trying to shut those down. Now, like I said, now that since the weekend, we found the Delta variant. So we've now gotten, having to zoom in on what's happening. Like I said, particularly with the tourists. This is the first time since I've been minister, and I think the first time since the virus has been around, we've got more tourists positive than we've had people from our residents. So that's going to cause us some problems. We're having cabinet tomorrow, so we're going to be looking at new measures, and everything is on the table right now. But we certainly don't want that Delta variant to get out of hand. But as the doctor, I'm looking at him on the screen. Certainly this would be surprising to him, or probably not surprising, that out of 8 positive samples we sent out for sequencing, 4 of them came back with the Delta variant. So you know what that says about what's in the community. That tells me that a large majority of the cases in the community would probably Delta. At least it's going in that direction. If 50% of the positive cases came back with the Delta variant. So we're focusing on that. We're trying to proactively manage it, but we've done a pretty good job because a lot of our neighbors, Haiti, the Dominican Republic, the Bahamas, those are seeing cases grow very, very rapidly. And so that's why I said we've done a pretty good job. But I expect that we're going to start to see cases increase because the Delta variant is now in country.
Yeah, I think you mentioned a very interesting and important point, right? Is that when the vaccine early on, it shot up in terms of people getting vaccinated. It was a much faster process. And now we're seeing I think, not only in the Caribbean, but also in the United States, the slowing of the rate in which people are getting vaccinated. I'm not sure, Doug, if you can share any more about kind of, from the CDC's perspective, both how a lot of those things like the mask mandate and vaccine provisions come to be, as well as anything you can share about the vaccination rate in the U.S.
Sure. So just to be clear, so I can't speak on behalf of the CDC or the CDC Foundation, but but you do see that same tapering off that the Honorable Jay Saunders just mentioned in the Caribbean. The first half of the U.S. lined up to get the vaccine, and then it was a slow crawl to that 70% metric that we just recently hit, and it's the distribution of that is a little bit different, right? It's that number is higher in New England and out west compared to in the South and in certain parts of the Midwest, and it's also different depending on what age group you're in, right? The younger individuals have a vaccination rate and proportion that's much less than the older population, and you also see a disparity in that regard by race. And I was just looking today, and even though we've been getting better, we're still pretty far off the mark, I would say. The CDC has a COVID data tracker that's available to anybody that wants to look and see what's going on in the U.S. And there's a metric that shows you the percent of people receiving the COVID vaccine by race and ethnicity, and it's a pretty there's a pretty stark difference. You know, if you look at Asian, non-Hispanic populations, their percentage of fully vaccinated individuals is about 37.1%. American Indian and Alaskan Native, they're about at 41.2%. Black and Latinos at 31.2%. White non-Hispanics at 33.5%, and the Black non-Hispanic population is sitting at 25%. And believe it or not, that's better than where we were. But that slow crawl is really leaving us exposed to things like the Delta variant, which is taken hold and threatens a lot in terms of being able to fight COVID. So.
Thank you, Doug. No, I think that's fascinating. And it's, there's stats that people don't really understand. We talk about them, but don't really understand the differentiation, I think, between the numbers as a society as a whole. And when I think of that, Jonathan, I know this really was at the heart of founding Hood Medicine. This idea of, I call it have and have nots, but that have and have nots in this case is really two Americas, right? And it's really two echelons of society, no matter where you are, which is one is vaccinated and the other is unvaccinated. Can you talk a little bit more about that from your perspective as a founder of Hood Medicine? Yeah,
interestingly enough, we had this conversation recently. I tend to think we're divided into three Americas, and it's important to really distinguish. Obviously, we have the vaccinated population, but there's two cohorts of unvaccinated, and we have to look at them differently and treat them differently. There are the unvaccinated and hesitant, and in that group, you'll find a lot of Black and Brown families, members of those communities, those folks who have some reasonable distrust of government and of medical establishments, dating back to, forced sterilizations and Tuskegee study, among many other, violations of them by government and by the medical community. And then you have the unvaccinated and resistant population. And that population, I believe, and I think Dr. Hotez can attest to this, is led primarily by political ideology and an aversion to scientific fact. The sad part now, I believe, is for the last several months, I think, there's been this hard-turned focus to get conservatives vaccinated, to get conservatives to believe in vaccinating to save themselves. And I think that took a shift off of other communities who are vulnerable and need to have proper messaging going to them. We can't approach those two communities the same. One of those communities is just not making their decisions based on fact, science, logic, nothing at all. I've had plenty of conversations and arguments and debates with folks. I had a conversation with somebody today who told me we can't figure out what variant somebody has because we can't test for variants. And I told them I spent several years of my career doing DNA sequencing. So I know we can sequence DNA samples and figure out which variant people have. Those people just don't believe in science. They don't believe in fact. They believe in whoever their political leaders are and what those political leaders say. And until those political leaders decide that they want to make a shift to protect all of this country and our global community, those people aren't going to make any changes. The people we need to really focus on right now are the folks in those vulnerable communities, the Black and Brown communities, the poor communities, some who don't have access to the vaccine, and some people who just have a reasonable distrust of a government. We need to talk to them in terms that they understand. We need to address their concerns, full-throatedly. We need, as a nation, we need to apologize to those communities for what we've done to them over the years. And I want to be very clear. This isn't just about, going back to Tuskegee and some of the other, medical mishaps that we've had. Oftentimes today, you'll find Black and brown people who don't get good quality care from their physicians, people who go into the doctor's office and don't come out with the best outcomes. So if we're not addressing those issues full on and talking about them in a very honest way, we're not going to be able to tackle that second group of unvaccinated people.
Absolutely. That's a great point. I spent personally the last year essentially in the Bahamas, and it was interesting to see what a strong factor that myth, I call it urban legend, played a part into people's opinions towards the vaccine, towards the virus, et cetera. I feel like governments, whether we're looking at a state, a city, a county, a nation, have had a really hard time in terms of giving us good information that's accurate, because a lot of us are learning as we go along. In contrast, and I go to you again, Deputy Premier, is on the government website for Turks and Caicos, you actually have a Mythbusters section, which I love. And how effective has that been in helping to dispel some of the myths that are out there? And I'd love to hear your personal opinion on some of the most outlandish concerns that people have with respect to the virus and vaccines.
Well, the issue that we're having is that the MythBuster section actually helped us in the beginning when it was more medical. When you had persons who were saying that they still want to have kids, and they are hesitant because they think it was going to affect them in terms of the fertility, the ability to have kids in the future. So that MythBuster section worked well for that. But it doesn't work very well for those who have religious hesitancy, who actually believe that it's the mark of the beast. And so we are running into that now. So we have a whole section believe that if they do it, something's going to happen to them, and they're not going to go to heaven. And then we've got the young, there's a certain group of young folks who just don't want to do it. I think they think that they're invincible and that they don't need it. And we have a bit of a group that believes that the only thing I can call it is bush medicine, but basically natural herbs and remedies that they can use in order to strengthen their immune system. But the MythBuster worked, like I said, it worked well in the beginning, but now what we're running into is persons who it's going to take a lot more than putting the MythBusters up on the web page to try to address their concerns. We're going to almost have to pull them across the finish line, because, like I said, particularly those with the religious concerns, they're not going to move. I met in person with some pastors from the Christian community, and they're dug in. I mean, there's nothing that you can get to change their mind about it. They truly believe that it's going against the Christian doctrine of being vaccinated.
Yeah, I think that's it's interesting in terms of the messaging and in the way that's changed over the course of the pandemic. And I'm curious, Dr. Hotez, you might be able to speak to this, but in your work with vaccine hesitancy and resistance and advocacy around it, is the hesitancy now, a normal thing in relation to other vaccine concerns historically, or is it different in this circumstance?
Yeah, I mean, I think it's changed and it's evolved, and of course, as you point out, the anti-vaccine groups don't speak with one voice. I think, in terms of the conservative groups, this is a relatively new trend. The modern anti-vaccine movement started around fake links between vaccines and autism with a paper that was published in The Lancet, the British Medical Journal, in 1998, claiming that the measles, mumps, rubella vaccine caused autism, and at that time it was called pervasive developmental disorder. And that paper was debunked because of work from people like our group and others that put a lot of time and effort into it. And what happened was the anti-vaccine movement was losing steam. And so by 2015, they did a pivot. They took a political pivot to the far right, and it happened here in Texas when they linked themselves to the Republican Tea Party around this banner of health freedom or medical freedom. And that's when it took that spin to conservatism. And at that time, it was far right-wing extremism. But the far right wing donors started supporting political action committees that were primarily focused on an anti-vaccine platform, again under health freedom, medical freedom. And then this really accelerated in 2020 when those same health freedom anti-vaccine groups also protested masks and social distancing. So it became a full-on anti-science activity. So one thread is the political right, and that's what we're seeing play out, I think, a lot in the South and the Mountain West, where now being against vaccines has become part of your tribal allegiance to the GOP, to the Republican Party, which is, relatively new. It never used to be this way, but it's causing a lot of damage. And you're seeing this play out at the CPAC conference, where elected members of Congress are saying that first they're going to force vaccines, again, this health freedom, medical freedom concept, then they're going to take our guns and Bibles. As ridiculous as that sounds, there are a lot of people who accepted that. And then it was saying that vaccines are nothing more than a coercive measure to gain power by the Democratic Party, and people believe that too. So that's a big thread going on in the South right now, accounting for vaccine hesitancy, particularly in resistance, particularly among young people, and in the Mountain West states. But you also pointed out a second group, which is pretty high vaccine resistance in the BIPOC community. And I'd be curious from your perspective, because that's also new, I think, for a different reason. When I think of BIPOC communities, I don't ordinarily think of those groups as, in the past, as resisting childhood vaccinations. I mean, when you looked at CDC data, vaccinations by race or ethnicity, you just didn't see those groups necessarily being up there. Yes, in some places where access was an issue, especially for the HPV vaccine, it was a problem. So this, the statements, distrust in government, yeah, I'm sure it's always there, but in the past, it hasn't really translated into declines in vaccination rates. But for some reason, it has now because of COVID vaccines. And I don't think we fully understand that. I think part of it is a different type of targeting. So in the, for the conservative groups, it's the anti-vaccine rants on the cable news networks like Fox News, and it's and terrible behavior by elected members of the United States Congress coming from the political right. I think in terms of vaccine hesitancy in the African American community, that's relatively new. I think it's deliberate targeting by some of these non-governmental organizations. And we've spoken before about this horrible sort of phony documentary that's out there that shows pictures of African American groups getting the Pfizer BioNTech vaccine, and then it switches to grainy black and white images from the 40s and 50s of Tuskegee experimentation, and trying to draw a parallel. So I think that has done a lot of damage. And then the question becomes, which is the bigger problem? I know they're both problems, but is there one that's dominant? So here are the numbers. We have to vaccinate about 85% of the US population in order to halt the Delta, the variant. It's a huge bar, because the more transmissible a virus is, the higher the bar for vaccinating. So, and the informal number we use is 1 minus 1 over the reproductive number of the virus, which gets to about 85% of the population. So far, we have vaccinated about 55% of the US population. So that leaves, another 30% roughly that we have to vaccinate. So that's a lot of people, right? That's 100 million people. And it looks like a lot of them are in the South, especially. And the question is, of those 100 million, what's the balance? Because you're right, how you manage getting them to overcome vaccine hesitancy and resistance, a very different dynamic if we're talking about conservative groups and people tying their allegiance to far right-wing extremism versus hesitancy in BIPOC and African American communities. So for instance, right now, the Gulf states are the worst. And What do the Gulf states have? The Gulf states have some of the highest percentages of conservative groups in the United States, right? Guess what? They also have some of the highest percentages of people of color in the United States. So is it this combination? And the reason you need to know it is because you need to know what you're dealing with if you're going to solve the vaccine hesitancy resistant issue. And I don't think we really fully understand that. We know both groups are at risk. We know both groups are high density in the Gulf Coast states, in Louisiana, Alabama, Mississippi, going into northern Florida. But I don't think we really have a sense for that. And I think knowing that is going to be really important to solve it. And you know, we don't have a lot of time because schools are opening, and as I say, opening of schools is going to be a big accelerant right now.
Yeah, I just want to add one thing to what Dr. Hotez said. There's about 75 million children in the United States from newborn to 17 years old. That's about 20% of the U.S. population, a little over 20% of the U.S. population. If we can vaccinate the large majority of those children, and we know we won't be able to do that until at the very least sometime at the end of this year or early next year, if Pfizer and Moderna's vaccines get emergency use authorization for children under 12 years old. But if we can vaccinate a large majority of that population, that will get us closer to that 85%. And it's going to be necessary.
That's absolutely right. And when you look at the numbers, they're kind of interesting. So if you break it down, let's look at north-south. Okay, so if you look at the percentage of those over the age of 65 vaccinated, there's not that much of a difference in north and south. So it's a little bit. In the south, it's about, you know, the worst performing states in the south have about 80% of those over the age of 65 vaccinated, as opposed to 99% up in New England. So there's difference, but it's not dramatic. Where the bottom falls out is among young people. So for example, you have about 16% of adolescents in Louisiana vaccinated. You have over 70% of adolescents vaccinated in the northern states. So basically, that's the difference between none of the adolescents and all of the adolescents. And again, how much of that are kids of conservative parents versus BIPOC? I don't think we really have I have hypotheses, but I don't think we really know. And that's where things are going to go very badly among those very low vaccination rates in among young people in the southern states.
Yeah, I mean, I could tell you, Dr. Hotez, you know me. I worked in the space for about a year now. I am a vaccine advocate. I got the vaccine as soon as I could take it. But my 13-year-old son just got vaccinated this past Sunday. You know, so as a person of color, with a child, it's still very difficult to make that leap to putting your child. You know, I think as a parent in general, we don't want to expose our children to any risk at all. And so understanding that there is a very rare risk of something happening to your child, and an even rarer risk of something severe happening to your child, it's still a risk. And so as a BIPOC parent, you know, we still have some hesitation in doing that for our kids. So I wouldn't be surprised if those numbers in the South were also, you know, because of that reason, because we're a little hesitant to take that leap with our own children.
So then we get to Jonathan and Dr. Hotez. You know, you've each spoken about this wall, I think, that we're hitting up against. And Deputy Premier, you also addressed this in terms of, you know, we've gotten to this number, but we're unable to cross the threshold to getting more people vaccinated. And I'm curious to get your perspective, Doug, on this one in particular. So what do we do? Like, how do you think, and of course this is Doug personally, not the CDC speaking, but how do you think as a country we've handled the marketing and messaging behind COVID to get beyond that wall? And then what's interesting is because we've been playing catch up really since the beginning of the outbreak of the virus, is what are we doing to address what Jonathan and Dr. Hotez have just described? So how are we addressing fear for children, specifically in these communities that are most at risk? Do you feel like we're making any progress in that sense?
That's a really tough question. What do we do? I'm not sure, to be honest. I think the past year and a half has been a master class on how nothing is just science or just human behavior or just communication or just politics, and how all of these things can come together to create something very challenging, a wildfire that spreads pretty easily. I think there's been some hard learned lessons in some places, and some areas in which I think those lessons weren't really learned. And I'll give an example. Dr. Hotez and Jonathan just spoke about this back to school transition being an accelerant. Well, it doesn't need to be, right? Over the last year, we learned that there are things that can be put in place, like masking and distancing and doing hybrid learning and cohorting, all these different approaches that allowed schooling and kids in school not be a significant contributor to community spread, right? But if you look at how we're approaching things now, you see a lot of educators with their hands tied because they're not able to implement those lessons learned, like due to things that are beyond their control, and that's unfortunate. That says that at the intersection of all those aforementioned forces, you don't get the best of each one, right? You can just as easily end up in a situation where you know some good things to do and to implement, and you still feel like your hands are tied, and you can end up taking backward steps. So I think we've learned things, and then there are things we still haven't been able to deal with, and I think misinformation is another thing that contributes to the spread of hesitancy and resistance, and makes things more difficult, that also rests at the center of all those forces that I previously mentioned. So the short answer to your question is, I'm not sure what we do. I think the things that we know to do, we aren't doing to the degree that we should. And so, you have to get the fundamentals down before you can do anything else. And we seem to struggle with that, unfortunately.
And I think the stakes are pretty high, because now that not getting vaccinated is a thing among young conservative groups, and not getting vaccinated is a thing among BIPOC communities, what happens after COVID? I'm worried that there could be spillover to other vaccines. For instance, we've seen a pretty big drop off in HPV vaccination for cervical cancer and other cancer for adolescents. What happens? Is that going to bounce back, or is this now some permanent injury to the vaccine system? What happens to childhood vaccinations, MMR vaccines? I know they went way down because of the social disruption from COVID-19, and they're slowly coming back, but I worry, do they plateau prematurely because of now that vaccine hesitancy has now become, or refusal has become, more established in these communities? So we may be paying the price for this for several years to come.
Absolutely. And We're already at 10 till the hour, and I would love to turn back to you, Deputy Premier, and talk a little bit about successes and lessons that we've learned so far. And one of the things that I've observed in the Caribbean is this idea with vaccinations of providing incentives, we'll call it. You know, lockdowns tended to be a little bit more severe on a lot of the island communities. And people were very motivated to do what they needed to do in order to get back out into society, for the economies to recover, et cetera. And so I'd be curious to see, as a small country, I'm sure there's a lot we can learn as a much larger country in the United States. And I'd love for you to share a little bit about that, is what can we learn from Turks and Caicos?
Well, the Turks and Caicos has a small population, and so because of the small population, you know everyone, and so it's we can do things that you probably can't do in North America, because we know where the pockets of resistance are. So we can go, for instance, the island that I grew up on has at its best maybe 1,200 people, and so we can look at it and say, okay, we've done 300 or 400 vaccinations in that town, and then we know pretty well who are the holdouts. And so you could focus on those persons and zoom in on them very quickly and get it up. And so that's been successful in terms of targeting the groups that are being holding out. Or I don't want to say hold out yet, because we had the groups who were lining up at first, and then we have those who are a little bit concerned. You can zoom in and do the things that I'm saying right now. And then all of a sudden you hit a wall. And so what we started to do is that we started doing community vaccinations, like mobile vaccination clinics, setting up those things. And it's something, I'm just going to segue and say it's an idea that we did when I was in the telecommunications industry, on how to sell phones when you were selling them under tents. But we're doing the same thing with vaccination, having mobile vaccination clinics, and that did very well. But now, like I said, we've got up to that wall. We have a lot of immigrants into the country from the region, particularly from Hispaniola, the DR, and Haiti. And so we are finding a lot of resistance, particularly in those communities, particularly in the Haitian communities. And then, like I said, the young people. But to answer your question specifically, I would say that the community work that we did, getting people out into the community, going into the houses, going to the people that we knew that was being difficult to bring them across, and targeting them, having messages that are targeting those specific groups. Like that worked well, but I don't want to say that has not been a home run, because like I said, we've been stagnant at 66% for a few weeks. So I think we've run the course of those messaging and all of the things that we tried in the past. So now I guess it's time for us to go back to the drawing board and see what we could try. But what worked for us before was certainly the community initiatives that we were doing.
Thank you. I definitely want to get this one student question in the chat that I'm hoping we can tag really quickly before we start to close up. Dr. Hotez, Sterling Bland asks, I'm curious, as a student from Colorado, what do you predict will happen with COVID's transmission in the Mountain West? What is your advice in talking to hesitant family members who might fear the vaccine could be harmful to their Black children South?
Well, the way it worked in last year was we saw a big surge over the summer that began a couple of weeks after the July 4th holiday. And that happened this year as well in the South. And then the other thing that happened was, as we headed into the fall, then you saw a big surge in the Great Plains and the Mountain West states. So I think, if Mother Nature usually tells us what she has in mind. And I think that's where I'm going to really worry, as we get out of the summer into the fall into September, then you may really start to see those numbers climb up in Colorado and elsewhere. You never know, it's a new pathogen, but I think that's a likely scenario.
Thank you. Jonathan and Doug, I want to, while we don't necessarily know what the answer is to the problem, I think we're able to kind of look to bright spots and successes we've seen in our work to hopefully have some sort of example to emulate or learn from. And so I'm curious, in your work, Jonathan and Doug, where you've seen success in terms of getting past those that hesitancy or that marketing point, where you've seen success in getting people to engage more with the vaccine.
To be quite honest with you, I think this may be a little controversial, I don't necessarily believe we've seen true success yet. I think what we've seen thus far is what we should have expected when we're in a global pandemic and a vaccine is available. Success to me will be when we start to engage and get into those communities that are hesitant and resistant, and to get those folks vaccinated. Obviously, the rollout was a success. I think the way many of the states have handled it was a success. But as far as getting the country vaccinated, I think this wall that we've hit is a wall that we should have expected. My thing is, I think we've had so many missteps, and I think Dr. Hotez mentioned this earlier, that we've had in this process, and so many hiccups that could have, if they were avoided, put us in a better position than we are right now. One of them is, I respect the CDC, and I believe and trust that everything that they give to us is based on science and data. The CDC's role is only to look at the science and data and give us guidance based on it. It's then the job of the politicians and elected officials to take that information and make policy based on it. And I think what politicians did was kick the bucket and leave the onus on the CDC to provide policy for the entire country. And what I mean by this is when the CDC came out and said that it is now safe for vaccinated people to no longer wear masks, instead of politicians in various states saying, well, that's great guidance, we believe in those facts, but we know how people are acting in our states. We know how, what we see day to day in our states. And because of what we see, we think it's advisable for us to keep mask mandates, running. Their goal was instead to get back to normal as soon as possible. And because that was their goal, they manipulated the facts to meet that goal rather than looking at what was actually going on. I think we all knew that viruses mutate. We all knew that when viruses mutate, oftentimes they become more transmissible and more dangerous. I think we all knew that masks did a great job at mitigating the transmission of the virus. I think we all knew that crowd control did a great job at mitigating the virus and being socially distant. All these things are things that we knew. And when you started taking those things away and focused on getting back to normalcy, rather than continuing or focusing on a mitigation strategy, that's when we started losing. And that's why we are where we are today. And we can't continue to make that misstep. So, I'm in the state of New Jersey. I've been harassing my governor on Twitter several times a week to reinstate the mask mandate. We have to have a national mask mandate, because if people vaccinated or not are walking around without masks, if they have the Delta variant, we know that transmission is much higher than it was before with the original strain or with the alpha strain. So we have to mask up so we can continue to protect people, particularly our 5 to 12-year-old kids who aren't able to get vaccinated right now. So we have a lot of mistakes that we made that we need to learn from. And if we don't learn from them and hit the ground running heading into the fall, I think, as Dr. Hotez mentioned earlier, we're in for, a bit of a shell shock once again.
Absolutely. And Doug, I'll come to you just in a second. And just so everyone knows, we're getting close to the end of our talk, but I'd love to know, just to bring it together, and Doug, your perspective with, obviously from the CDC and also from Hood, but also get parting thoughts from Deputy Premier and also Dr. Hotez in a solution. So how do groups like Hood Medicine, how do they partner with governors or governments and help them to address this idea of vaccine hesitancy? And I want to go back to and just mention quickly this idea of what you said, Deputy Premier, in the Turks and Caicos, and this idea of really targeting and personalizing messaging. And I look to one of the attendees, Quentin Shipley, thank you, who gave some great examples in both Alabama and New Jersey of the personalization of even of conservative politicians who have told stories, who have told, tragedies really of what's happened of people that haven't been vaccinated. So how do we bring all those pieces together to really get this last 40, 30%?
think I think that part of the answer is in building trust and coming from um, using a culturally competent approach. And I think that is what makes hood medicine have as much potential as it has in terms of affecting that kind of change we hope to see. Um, Trust is really, really low right now. If you can just see in different conversations that are happening around you or online in online spaces and social media spaces, and you can see that oftentimes the conversation just shuts down once you know where people stand in terms of whether they're in support of whether they're a vaccine advocate or against the vaccine. They kind of they tend to retreat to their corners rather than meeting in the middle for substantive discussion, right? And I think that coming from a place and building trust um, is how you get closer to uh, helping people understand each other. I think that's part of it. And just to comment on what Dr. Chipley mentioned in the chat also about Governor Christie and other such stories. I think, and I've seen this a lot in the news this week. I think now you're seeing a lot of horror stories of individuals that you know were hesitant but not averse to getting the vaccine. Uh, their hope was just to wait a little bit longer to see what might happen. And unfortunately, in several of those instances, a loved one was lost. And I think the reason that's happening is because it's easy to dismiss numbers and statistics and charts and graphs, but it hits different when you put names and faces and context to these stories of people that are being lost to COVID, um, and giving that a voice. So I think we have parts of the solution, and I think it entails those two things.
And Deputy Premier, what does that look like? So how can a Hood Medicine or groups like Hood Medicine help you? I'm thinking of you going into a meeting tomorrow, and how can we help you start to communicate the messages that we've talked about?
Thank you. Just before I pick up that specific question, I want to say that the comment that was made earlier, the issue is that as government officials, right, and I agree with the sentiment that we might have dropped the ball because you're not making the best decision when it comes in terms of pure risk, and from a risk mitigation point of view from around COVID. But what happens is that as government officials, you're looking at a bunch of things at the same time, particularly lives and livelihood. And so when you step in, you're also looking at the economy. You're also looking at how can we find the right balance? Because I know that we were elected on February 20th. And the first thing that I was confronted with as Minister of Health, but also as the Deputy Premier, was what are we going to do for the economy? Because the economy was shut down. And so people didn't have no income coming in. And people were screaming at you saying, I need income, I need income. And then the government, certainly, while we had some cash on hand that we were able to give a stimulus, we couldn't maintain that for a long period of time. And so then we end up having to look and say, shutting the economy down for 2 weeks, we know we could get the virus down all the way to zero. But can the economy sustain that? And so that's where you have politicians making those policy decisions that doesn't give you the 100% effectiveness from a risk mitigation point of view, and then sometimes allows the virus to stay in the community. That's what we're faced with. And so we in the Turks and Caicos, we tried to find the right balance, and I think we did, at least for a certain period of time. Now, like I said, we're starting to see the caseload get up and hover around about 30, and we're trying to proactively manage it back down. but while also keeping the economy open enough where persons can make money. But to answer your specific questions, how can you help us? I mean, it's things like this. I mean, this creates the ability for us to have this conversation, and it creates the contact. So now, reach out to us, because we don't know all of the groups that are out there, and I'm happy that I was invited on this, because now we can take this conversation and turn this conversation into a partnership, and then turn that partnership into actionable items that can now that we can roll out into the community. We will take any help that we can, because we want to get to 80%, to get to herd immunity. And now I'm hearing that to say 85% because of the Delta variant. When we came in, we didn't have any guidance. We didn't know what the number was, so we said 70%, and we will fully open up the economy. And then as the evidence came in, because we're normally guided by the CDC and Public Health England, so Public Health England came back and said, we think you'd get herd immunity at 80%. So even though we had already promised the public that we'll fully open the economy at 70%, we now know that 80% is the new benchmark. And as of today, because of the doctor saying that it's 85%, so we now have to relook at that. So to answer your question, I would think keep the conversation going and reach out to us. Anyone who's listening to this, if you think you can help, I would love to hear from you.
Definitely look for that. And with our ultimate parting thoughts, Dr. Hotez, I know you have to run, but give us some inspiration or a challenge as we look ahead. We have a lot of—
Thanks so much for having me. It was a great discussion, very meaningful. We've got to close the gap, right? So we've got, at least on the US side, we've got to vaccinate a quarter of the US population, and now we can't screw around and wait. And unfortunately, now we're going to start seeing we're going to pay dearly, as we'll see a lot of adolescents, maybe even younger kids and young people go into pediatric ICUs and other ICUs. I think some of that will be auto-correcting. I think as enough parents start hearing about young people and kids going into hospitals from COVID, they'll get it, and there will be some auto-correction. Vaccination rates will go up, but that will only take us so far as well. And so the only two other levers we have is to counter the anti-vaccine aggression by doing something definitive with these anti-vaccine groups, whether it's deplatforming them or trying to limit the damage that they're doing, or and not mutually exclusive, we're going to have to expand mandates. We're already hearing the mayor of New York wants to require vaccines for restaurants and going to the gym, and we may see more of that. Also doing something about school mandates for vaccines. Nobody wants to do it, and everyone's trying like heck to avoid it, but that may be what's required as well. You're muted.
You're muted, Sienna.
Thank you. I still forget to press the unmute button a year and a half later. But thank you so much, Dr. Hotez, Deputy.
Thank you very much. Thank you for a great discussion.
Thank you. I know you have to sign off. Doug,
Bye-bye.
And, we really appreciate everybody's today. I think we have a lot to do, and there's a lot of great ideas that have come out of this. I think we have about 10 other conversations that could be born out of the comments that were made this afternoon. Drake, do you have some final words?
I think the Honorable Saunders said it properly, right? Like, this is the conversation that needs to happen in order for us to move that forward, especially with the community and government partnerships. And that might be the key, right? That's been missing to get that 85%. So.
Absolutely. Well, we thank everybody that's been on today and stayed with us for the hour. A recording will be available. We'll share that with all the registrants. We're really looking forward, as I said, to continuing the conversation. This conversation only expands as we get into the school year, get into children's vaccinations and all the other topics that we hit upon today. So thank you so much, and wish everybody a safe rest of day. Thank you.
Thank you.
Take care.